Well, how safe is your hospital? Consumer Reports compared surgical results in hospitals across the country and found that several here in Michiana were above average. News Center 16's Tricia Hart joins us now. So, Trish, what do these ratings mean for the average person?
Well, Terry, they provide people with more information. Hospital ratings are particularly important when it comes to post-surgery problems. If people know more about the likelihood of death or infection, they can make more informed decisions about where to go to have certain procedures done. Undergoing surgery is scary enough with the risk of infection or complications.
I think that's a very natural fear for anybody to have. I mean, it's an unknown.
But what's even more common is things going wrong after you leave the hospital.
You know, if you have a fall or you have an infection unrelated to the surgery, or your diabetes goes out of control and you have to stay longer, or you need a transfusion.
That's why Consumer Reports rated hospitals on a worst to better scale for surgical results among Medicare patients.
This study was based on mortality and like the stay in the hospital on patients 65 years and older. And it's a really good representative and a good group that you can pull all the data on pretty easily.
On the 1 to 100 scale, St. Joe Regional Med Center received the highest rating in the area with 66 out of 100. IU Goshen a 56, Elkhart General 62, while Memorial and Lakeland both received 59.
It's a real indication for you as an individual of your likelihood that you're going to have an adverse event, you know, during your surgeries.
And an indication for hospitals of how well they're matching up.
We benchmark against multiple hospitals in a lot of ways, quality, safety, financial, etc.
And it's that competition and concern for quality that keeps hospitals minimizing risks.
When you go in, you're one patient, and so while your likelihood may be less that you have an issue or problem, you still have to ask all those questions. Because any one person can face, variable environments.
Now, while the hospitals in our area fared pretty well overall, there's still room for improvement. One area that they seemed to do worse in was doctor and nurse communication with patients. They rated below average in that grouping in particular.
And this sounds like a fairly expansive study. Where can people find out more about these hospital ratings?
Well, actually, there's several online websites that people can go to and actually compare those hospitals, and I'll have links to those on our website. But basically, they let people be able to compare different procedures, rates of readmission, and deaths for particular surgeries.
All right, but it's nice to see that the hospitals in our area are doing a pretty good job.
Exactly.
All right, thanks, Trish.